hand versus chainsaw. It looks painful.
Our hospitals are taking care of more patients than ever.
You're right.
With medical teams under constant pressure.
Can Dr. Pixie come to resource, please?
Somebody as poorly as this little one, we really need to treat them quickly.
To meet our expectations.
I'm just worried about what it's going to be like afterwards.
But there's a crucial member of the team we sometimes forget.
I've never ever been on a bed like this.
The hospital bed.
Another ward, another story, another bed.
In our lifetime, we are likely to need one of them at least 3 times.
I've probably spent a quarter of my life on a hospital bed.
In this series, our cameras have been given unprecedented access to beds in 4 very different hospitals across the country.
It's life and death and everything that goes in between.
We'll see the world through the bed's eyes.
Hello, my love. Hiya.
As they share the most challenging,
I don't know what to do. I don't know.
most intimate, and most rewarding
Happy birthday. Hospital
moments of our lives.
Thank you for being here.
Have you been anywhere else?
And a hospital cannot function without beds. Beds are vital.
This is the secret life of the hospital bed. In the heart of Newcastle is the Royal Victoria Infirmary.
I would imagine he'd probably be admitted with a cardiac history, and in fact he's had 6 days of pain.
Its A&E department is one of only 5 units in England to have emergency consultants on call 24/7.
Let me give her some diazepam and get her in the CAT.
There are 29 beds on the unit, and like the medical team, they work day and night. Often, they are busy transporting patients.
You okay there? Start now.
A&E Bed 9 has just become free. 22-year-old Lewis will be its next patient. He's come in with intense pain in his knee and hip. He thinks it's due to a condition he's had since birth.
Basically, I was born with bilateral talipes, which is better known in layman's terms as clubfoot, where I had my feet the opposite way around and snapped back into place.
Around 1 in every 1,000 people is born with a clubfoot. With quick treatment, most recover early in life. But Lewis has had complications and still suffers pain.
I'm not sure if the pain's coming from my spine into my lower back, or if it's actually to do with just the muscles in my leg or what. My entire leg just goes numb, and I get no feeling in it, and then all of a sudden my muscle will like sort of jump and tighten. But when it tightens, it doesn't relax again, it just stays tight, and my leg starts seizing up and twisting in like that, and that's where the pain comes from, and it's just ridiculous. I do have them days where I just want to cry and cry and cry, don't go to work, and I just want to sit in and just feel sorry for myself.
Lewis settles onto A&E Bed 9.
You're right. My name's Max.
He's assessed by Dr. Richardson.
When does the pain get worse?
It tends to get worse on a night, but it does get worse at any point.
Okay. Does walking make it worse, or is it just there all the time?
It's there all the time, but don't get us wrong, my crutches make it easier, don't get us wrong, you know.
And are you taking any medication at the moment?
Nah, nothing works. The only time it's not hurt has been when I've taken like morphine or something like that,
right,
you know,
okay,
like a morphine based, like opiate.
Yeah.
Fair enough, I still can't like move it and kick it about and whatnot, but I can sit there painless.
Right, okay, fine.
Dr. Richardson needs to examine Lewis more closely.
I don't know if this has got anything to do with it as well, mate, right, but look at that.
Yeah, they're different lengths, aren't they? Whereabouts is it sore? Can you point to where the pain is in the knee, or is it all over, or?
No, it's like behind that.
Behind there? So
Yeah.
it's all in the middle of your knee, right behind there?
Yeah.
Does it hurt just sort of pressing on it?
No.
No? Can I bend your knee?
I won't be able to keep this leg straight.
Okay, that's fine. Just do whatever you need to do. So just Just try and relax as best as you can. I know it's easier said than done. Is that as far as you can let it go?
No, I can. If I bring my knee up right, I need to lift my bottom back off the floor. Do it like that.
Okay. So you can't bend it.
Yeah, that's absolutely ridiculous.
It's not really sore there.
No, not my knee, but it's just the leg pain is ridiculous.
But where's the pain in your hip there? Okay, right, we'll straighten you back out again. What about in your hip? Do you get pain in here?
Right, where you've just pressed the tank. It's painful there, but a bit up. Okay. There, that's the epicentre, mate.
So you get pain in your knee and in your hip. Okay, fine. I'm not really sure what's going on at the moment. I'm not entirely sure why he's got all this pain and what's been happening. Obviously, it's a long-term problem that he's come in with, and a flare of the pain today. So getting us to fix it today, I don't think that's going to happen, but we need some sort of plan for follow-up and investigation. And I'm going to go and have a chat with the bosses about how best to go about arranging investigation and further sort of management of this.
I know, obviously, the miracles that they can perform these days. You know, I know I probably will be walking again, painless and that, no problems, but at the moment in my head I can't see it happening. Because like I say, you know, it's been 2 years, every single day drilling in the back of my head.
The paediatric A&E department at the Great North Children's Hospital is run by medical staff who are specially trained in children's healthcare.
Hello, PTD.
Their 9 beds deal with just over 30,000 children a year.
I'm a little bit scared.
The PSC's just phoned me about a young lad that was coming from gastro clinic. So he does need to book in and then I'll get him seen and I'll send him back up to you. Okay, thanks love, bye.
High on the list of ailments are head injuries, up to 2,000 a year.
You will have a little scar here, but you won't know it's there unless one day you get your hair shaved off.
Paediatric bed 27 is ready for its next patient. 5-year-old Daniel has suspected concussion. He's come in with his dad, Andy.
Daniel had a bit of an accident at school today. Someone ran into Daniel and Daniel went flying across the ground and hit his head off the ground.
Yeah. Okay. Where the big scrape is.
Daniel?
No? Yes. Daniel, come on.
Nurse practitioner Rain takes Daniel to paediatric bed 27.
You're going to come through and have a little sit on our bed, is that okay? If you have a little sit up on there. Are you Dad?
Yes, I am.
Lovely. I'm Louise, I'm one of the nurse practitioners here. I'll just give my hands a wash and if you have a climb up on the bed,
Can I sit on there?
You up.
Whoa, jump up. There you go.
Oh, big boy.
The first task is to rule out concussion.
Oh, do you remember everything that happened? You didn't have a snooze or anything?
I didn't.
You didn't have a snooze. Have you been sick?
No.
No, that's good, isn't it? And how
I wasn't tired.
You weren't tired. That's good. Have you had anything to eat today? Had you had your lunch?
Yeah, tuna sandwich.
A tuna sandwich. You look at my big nose up there. I'll just see what colour they are. Brilliant. Pop your head up in the air. We'll have a little look up your nose. So if you go like that. Okay. And have you had a nosebleed or anything like that? It doesn't look like you have.
No. With no obvious signs of concussion, Nurse Rain needs to assess Daniel's facial injury to check for broken bones.
And then what I'm going to do, we'll have a little feel of your face. Do you like our comfy bed? Or not really? Is it like your bed?
It's comfy enough if I put my shoes off.
Yeah. I've let you sit up on the bed though, haven't I, with your shoes on? Would you be allowed to do that at home?
Yeah.
No.
Does that hurt along there? That's where you've got your bruise, isn't it?
It still hurts.
It still hurts. Okay. I think you've just got a mark there and a little bit of an abrasion and a little bit of a bruise. I don't think there's any broken bones, so that's really good.
Fantastic.
Now, do you like stickers?
Yeah.
Which sticker would you like? Because you've been super brave today.
The biggest one.
The biggest? Which one do you think the biggest is?
That one, because that's bigger than all.
Do you think it is? Where would you like to stick it? Next to the dog. Where did you get the dog from?
Got that from school, didn't you? For being brave.
And is this so they don't forget who you are?
I want it here.
You want it just there? Okay. Well, it was lovely meeting you.
What do you say,
Go
Daniel?
home.
Thank you.
Okay. So he's a happy little boy with no significant clinical findings. He's alert and he's doing everything appropriately.
It's a happy ending, nothing serious. We can go home and get some chocolate.
Within an hour and a half of his arrival, Daniel is discharged.
Come on.
Paediatric bed 27 is prepped ready for its next patient. Queen's Hospital in Romford has one of the largest maternity units in the UK.
You know where the maternity tree is? Yes, yes. She needs to come to be checked out, all right?
It includes a special centre for low-risk deliveries, with the option of a water birthing pool. There's also a higher-risk, consultant-led ward.
Hello. How are you?
A little nervous.
No, a little nervous.
Good luck. Thank you.
28-year-old Shirley is in need of a bed. She arrived at the hospital several hours ago. She went for a walk as she was only in the very early stages of labour. Now her labour is progressing. Maternity bed 7 has been cleaned and prepped and is on its way to meet her.
Shirley, you can go on the bed when you are ready, okay?
That's great.
Yeah.
I was advised to walk around and was just sitting in the restaurant and having a contraction. And I heard, gosh, the water broke. Oh, but hopefully no one saw that.
Shirley has come in with her 8-year-old son, OJ, her mum and her friend, Ona.
We're close family friends, more or less family. She's doing really well, very calm. So yeah, I don't think that would be me.
When she gave birth to OJ 8 years ago, Shirley tried to keep things natural, but she did have the painkiller pethidine. This time, she wants no pain relief.
I wanted as natural as possible. I wanted a pool bed.
But tests have revealed she has an infection, which if untreated, could put her unborn baby's life at risk. She won't be able to use the birthing pool.
I can't have a water bed anymore. It has to be bed birth.
So that one is out of the window now?
Yeah.
Babies born with the Strep B infection that Shirley is carrying are at serious risk if untreated.
Okay, so now I'm going to give you antibiotics. Okay, through there.
Midwife Boachi administers intravenous antibiotics.
We have to give antibiotics before baby is delivered. If antibiotics is not given before baby delivers, baby needs to have antibiotics. So we normally try to prevent it so that we don't have to, the babies don't have to go through all this pain and stuff.
Shirley must stay on the high-risk ward for the duration of her labour, so midwives can monitor her closely. The Queen Elizabeth Hospital in Birmingham employs over 9,000 staff.
Listen, my dear, give us the sex split of the patients that you want us to house. Are they definite go home tomorrows? OK, bye.
The day surgery unit is run with military precision.
Yep, lovely, thank you. We all know what needs to be done. Bring the patients in, get them sorted out, let theatres know. It doesn't matter who does it, as long as it's done.
Its 81 beds see around 2 patients a day. They work to admit, treat and discharge patients within a 12-hour shift. Day surgery bed 81 is meeting its first patient of the day.
Oh, they're going to have a nice view straight up my pants, aren't they?
39-year-old Carl is here for an operation on his nose.
Oh. Let me know if there's anything that can't be shown before the watershed.
He struggled to breathe through his left nostril since he was a teenager. He's looked after by Nurse Tom. Carl has already had 2 exploratory procedures this year.
In March I was hospitalised because my eye inflated, and it was because of my nose. It's always been like my left nostril, I've never been able to really breathe through it properly, and well, I was fine with it, but then I got an infection in my left side, and because I couldn't really breathe properly or clear my nose properly, it built up and built up and built up, and suddenly one night it just inflamed, and like my whole eyeball inflamed, and I ended up in hospital for 3 days. It was really quite scary for a while, because until they operated to drain it, my eyesight was just double vision.
Carl relies on his eyesight for his favourite hobby.
I'm something of an indie filmmaker in my spare time. I've done my first ever proper short film, which is a zombie film. It's a 6.5 minute gore fest, but comedy, zombie comedy, which we shot right in the centre of Birmingham, like in the middle of the weekend on a busy Saturday.
This time, he may have to have a stent inserted to keep the nasal passage open. That would mean being unable to breathe properly through his nose for over a week. Carl's consultant surgeon is Dr. McClelland.
Hello.
I'm all right.
Good. So the reason we're doing it all is to improve your breathing.
Yeah.
Main risks we talked about: bloodstained discharge, usually heavy for a day or 2 and then pink tinge watery for a couple of weeks. Small risk of infection, so we'll get you washing your nose out with a saltwater wash, keeping it clean until it heals. And it usually takes about 4 weeks for it to start cleaning itself.
Okay.
See you a little bit later.
Right, yes.
It's day surgery bed 81's job to get Carl to the operating theatre on time.
I think the main thing I always worry about just before I go under is just that moment of like, is this it? There's always that slight moment where you just think, what if? So maybe that's me, I'm morbid.
Okay. Thank you very much, Paul. Okay, no problem. So right then, sir. What we're going to do now, I'm going to put some bits and pieces on you to keep around you while you're asleep, all right?
Carl separates from day surgery bed 81 for his operation. In less than an hour, a lifelong breathing problem could be gone forever. Back at Newcastle's RVI, A&E bed 9 has been playing host to Lewis for more than 30 minutes. Lewis was born with 2 club feet, known medically as bilateral talipes. He's in extreme pain.
Just try and relax it as best as you can.
He's come into A&E to see if they can locate and relieve the pain. He's being treated by Dr. Richardson.
Is that as far as you can let it go?
Yeah,
and then where does it?
Orthopaedic specialists have advised Dr. Richardson to examine Lewis's back.
Oh, you don't have to roll right over, just onto your sides, fine.
No, I can't.
You can't do with your sides, fine. Okay.
Would you mind rolling it up?
Yeah, sure, yeah. Fine. Let's have a...
Right. When I sit down,
yeah,
it doesn't even have to be for a long period of time. If I've sat on a settee for like 5-10 minutes,
yeah,
my whole entire region here goes completely numb.
Yeah.
And I can't feel it when I touch it.
Okay.
But that there, whatever, let me just find the spot. That all in there, that is so ridiculously tender, it is unbelievable.
Okay. That's fine. I think we need to get your pain under control, so I know you've said they haven't helped, but we should definitely put get paracetamol in regularly, and either ibuprofen or naproxen, one of those two. And then for something a little bit stronger, and that's where I think maybe a thing of the Oromorph might be. I would only give you a little bit.
Can you guarantee that the Oromorph will at least take the edge off?
Yeah, it's a good pain relief, definitely. Just until we find out what's going on and we'll get some sort of treatment for it.
He will also book in Lewis for an outpatient MRI scan of his legs and back.
We need to find the cause for the pain, and that's something that needs to be done with further investigation, more in depth, and possibly operations in the future to explore the joints and things like that.
He's going to send an email to the orthopaedic team to get me seen to and to book an MRI. And he's prescribing me there the ibuprofen, the paracetamol, and the Oromorph. So it's better than anything I've had of any previous doctor ever. So I'm ecstatic with the outcome of today.
And then this is the prescription for the other one.
Lewis gets his medication
Syringe to dose.
and heads home. A&E Bed 9 is prepped ready for its next patient. "75-year-old Josephine is next in line for A&E Bed 9. Her son Barry and daughter-in-law Julie fear she may have had a stroke. She's lost control of one side of her face.
It's not an ordinary pain that you would take to tablet for. And I can't blink my eye, which is really irritating. It'll not blink because that side of my face is paralysed.
Josephine was a nurse for 53 years.
I don't like being on the side of the hospital bed. I like to look after her, not to be there. I wasn't going to do anything about it. They came over and decided I should come here.
You just need to get in as quickly as possible so they can diagnose the issue. If it's a stroke, they always say the faster the better. So that's the worrying thing.
Josephine is concerned that she may have to miss her grandson's wedding next week.
Well, my grandson's getting married on Saturday, and I've been asked to do his speech because his mum's no longer with us. So he asked me. It's all wrote down, it's all sorted. Just little things about my daughter, obviously, who's no longer with us, and how well the children have turned out with not having a mum.
Would you like to get up onto the plinth, so that's all right?
Josephine settles onto A&E Bed 9. She's assessed by Dr. Dolan.
So this all started with a headache, as far as you're aware. No trips or falls. Any visual changes? Visual disturbance?
Well, just because this eye
is irritated.
Irritated.
My plan going into a patient where there's facial weaknesses, I need to rule out a stroke. So I think about the worst possible diagnosis and I work back from there. Right, I'm going to get you to do a few things. Grip my hands as tight as you can, hold them there. So I try to rule out the stroke as the sort of first point, and then I'll look towards what is most clinically likely. Lift this up slightly, hold it there, don't let me press it down, don't let me pull it up. Facial weakness, arm weakness, speech slurring, they're the things that people will alert to stroke, and they're the things that people should present to hospital with if they're concerned about a stroke. Try to blow your cheeks out like this. Okay. So you're struggling with that? Okay.
Through a series of tests, Dr. Dolan aims to establish if Josephine's limited movement affects more than just her face.
The symptoms, especially in the face, are very, very similar.
Well, yes.
So, the rest of were all like, no, that's not happening. We're going to get it checked out. End of story.
If it does, she may have suffered a stroke. At Queen's Hospital in Romford, 28-year-old Shirley is on maternity bed 7. She's been in labour for 2 hours.
been having injections since 3 a.m. in the morning. We're just waiting for progress, able to progress. And then, yeah, we'll see how it goes.
Shirley wanted a water birth. That was ruled out after tests revealed she has the potentially dangerous infection, Strep B.
Is the light okay?
Yeah, that's fine.
Shirley came into hospital with her 8-year-old son OJ, her mum and friend Ona. Ona's nipped out for some fresh air.
Might be mine.
Hello?
Yes, yeah.
I'm going to get some food. You hungry?
Okay, yeah. There's Pizza Hut across the hospital, just opposite. And also, my mom wants some chips. Okay.
So pizza or chips?
Both.
What kind of pizza? Like margarita?
Pepperoni.
When she gave birth to OJ 8 years ago, Shirley had the painkiller pethidine. This time round, she wants as little pain relief as possible.
Now I think I'm coping quite well, better than before, because before I didn't know what to expect. But now I know it's coming every few minutes or so I can have a break in between, which is a good thing for me. It's not picking any interest in this. Hopefully you will when the baby comes out.
Women in labour are often advised to move around to help progress the birth.
Distract myself from the pain.
I have lots of pizza. And I got it 7-Up.
Some chips?
Yeah.
Shirley is trying everything she can to alleviate the pain.
Are you going to be sharing your toys though? Are you looking forward?
He's very caring, so I hope they get on well. It's been 4 cm since how many hours now? I hope it progresses quite quickly.
Midwife Boachi is looking after Shirley today.
The next bit will be they'll give you hormone drip to increase the contractions more. So by increasing the contraction more, that means we'll be forcing the baby head down.
Women who are induced are more likely to need intervention further down the line, but Shirley wants a natural birth.
Every baby is different, and plus this one is above the 95th center, so it's a big baby on board. The head is high, so for baby head to come down, it's going to take long.
Shirley moves again. She wants to progress her labour naturally. Finally, she returns to maternity bed 7.
I'm just worried that it's not progressing. Be positive about this, okay? Cry. Don't cry. Because this...
She's now been in labour for 5 hours. Her dream of a natural birth without intervention or pain relief is a challenge. Birmingham's Queen Elizabeth Hospital. In the day surgery unit, 39-year-old Carl is back on bed 81 following an operation on his nose.
There we go.
Thank you.
Okay, all the best.
How much do I owe you?
He's had problems breathing through his left nostril since he was a teenager.
Oh, forget that. How much did I drink? I feel pretty hungover. They really got on with it today. That was good. I mean, the anaesthetist was just like, boom, boom, boom. Didn't really give you a chance to think about anything. I was out before, you know. As far as things go, that was pretty smooth, I think. You know. I was out before I knew it.
First to visit is consultant surgeon Dr. McClelland, who performed the operation.
You okay?
Yeah.
Okay.
I'm sort of going in waves. I feel really lucid and then really tired.
You were very happy when you woke up.
Was I?
That's fine. Do you remember me talking to you in recovery?
Yeah. Yes. Yeah.
It
I
all
do,
went
yeah.
fine anyway. So I'll get you something to eat and drink in a bit, and then get you
Oh,
home later on
good.
this evening. All being well.
So you said no splint. There was no splints. Okay.
Just dissolving stitches. So lots of washes, keep things nice and clean.
How was it up there? Was it like?
Yeah, essentially the turbinate, the sidewall had scarred onto the septum. So dividing that, and it started to open up, and then just moving the septum across a little bit opened it up
Great.
nicely.
Okay. I can almost feel like I can breathe through it.
Good, that's the plan. We'll see you later.
Carl needs some time to recover. He's being helped by Nurse MacDonald.
Ham sandwich.
Oh, lovely.
What have we got in here? It seems very heavy.
That's a Kindle. All the electronic
Probably
bits.
not going to feel like reading anytime soon.
He won't be able to leave until staff are satisfied with his progress.
It really just felt like a really bad hangover. I feel much better now. I've had this tiny pot of orange juice, which was yummy, and it's fired up my taste buds, you know. So I now have this egg sandwich, which I'm sure will be glorious.
Carl's been out of surgery for an hour and a half now. His nose keeps on bleeding.
That's not really gushing at all. I don't know if it feels like it's gushing.
Oh, right. Oh, it feels like it's dribbling, but yeah, maybe it was just a prima donna.
A little bit.
15 minutes later, Carl's nose has started to bleed again.
I'll send you home with a couple of these because this will happen a lot. Using will be quite normal, okay?
Yeah,
You feel
okay.
really all stuffy for a little bit, okay?
Yeah. It felt like super clear when I just woke up from the op, you know. It was like beautiful. It wouldn't last. I just flexed my nose.
I thought it was moving from that tape on.
No, that was me. I twitched.
Oh, no. So we don't do too much like to aggravate it, so we don't go clean up the nose or anything like that. We just have to keep replacing the bolster.
Right. Okay.
It will be a month before he knows if the operation has been successful.
Fancy getting out of jail?
Yeah, I wouldn't mind, but I need to text my girlfriend to come get me.
We can start getting dressed.
So. All right. I guess the main problem with this over the years has been the lack of sense of smell. I'm hoping this fixes it. I might realise how bad the wine I drink is or something.
Carl takes the obligatory selfie. Then his girlfriend Caroline arrives to collect him.
Hey.
After 6.5 hours with day surgery bed 81, it's time to go home.
All right, we're off.
Yeah, I think a bit of an opportunity to just rest properly this week will do me the world of good, I think. So yeah, I'm just going to rest up and take it easy and hopefully feel better quickly.
Right.
Back in Newcastle at the RVI, A&E bed 9 has been with 75-year-old Josephine for 30 minutes. She's come into A&E with a suspected stroke, having lost the control of half her face. Josephine left it several days before telling her son Barry and daughter-in-law Julie.
She's so independent, and we always say, you know where we live, or you were just a call away. And then when something like this comes along, but it's a bit of an eye-opener for us.
I didn't think my speech was that bad. I was still thinking it's maybe this stroke, and I might not be able to talk correctly.
Josephine was a nurse for 53 years and has struggled to slow down since she retired last year.
She just does loads. She's always there for everybody. She's from a big family. There's 6 or 7 sisters, and she's the eldest, so she does the running around.
My sister the other day turned round and said, I just realised how old you are and what the amount of things you get through. Like, you know, I take them shopping, I do all my training, and I run them to the town, I pick them up, I pick their grandchildren up and everything.
There comes a time when you're going to need to slow down. But not yet, obviously.
Well, I mean, I managed to give a job up last year, how are you? I know it was 15 years later than I should have done, but...
She's always done loads, and she's just taken on this massive fitness regime where she's going to the gym, swimming, Zumba, you name it, all the time.
Josephine has a busy week ahead. She's planning to give a speech at her grandson's wedding in 5 days' time.
To be asked to do this speech at the wedding is just so important to her, and we just wanted to get to do that, and actually just to look normal, you know, to look that to get rid of some of that droop, and perhaps herself she doesn't realise what it looks like.
Dr. Dolan has carried out his examination and has a diagnosis.
So everything that I've seen on examination is reassuring that it's not a stroke. My diagnosis is that it's a Bell's palsy. Bell's palsy is a condition that affects the facial nerve. It's poorly understood the cause of it, but it's related to the herpes simplex virus. And the recommendations from the ear, nose and throat doctors, specialists deal with it, is that we do give steroids for you for 5 days. And that's in the hope of reducing the duration of it, okay?
Right.
Most cases resolve in time, but around 20% of them leave a more serious long-term problem.
The other issue is the eye. From our point of view at the moment, the main thing is to make sure that we don't cause any damage to the eye.
There's a high risk of long-term problems from Bell's palsy for people over the age of 60. Some patients develop ulcers on their eye, which can lead to infections and sometimes blindness.
The eye is failing to close completely. The reason that we've got eyelids is to lubricate the cornea on the outside of the eye to ensure that it's protected, and that's particularly important in sleep. And throughout the day when we're blinking, we're lubricating our eye constantly. So she's failing to do that at the moment. Well, we're going to give you some lubrication.
I've got some.
Have you got some ready? So what we need you to do is tape your eye closed. We'll give you an iPad and some tape to do that.
I've got iPads and
Have
tape.
you got iPads and tape? Okay. So you need to tape
That's
it at
the way
night
I've
time.
been went to bed for the last 2 nights.
It has to be completely taped up to protect the
Yes.
eye. Okay. Trying to avoid touching the eye. I know it's very easy for me to say that it's so
easier
irritated.
to close my eyelid because it's not closing, you see. Yeah.
Be careful when you get off the bed, it's pretty high. Okay, any questions from yourselves?
No, thanks very much.
No problem.
Reassured, Josephine leaves A&E bed 9. She's determined to say some special words at her grandson's wedding.
Very relieved that it wasn't more serious than it is. And my family are happy that it's not what they thought it was. It's fine.
It'll all be good.
It'll all be good.
It'll be cool for the weekend, that's even better.
Yeah.
Yeah.
I'll read my speech a couple of times and I'll be fine.
A&E bed 9 has been prepped and is ready for its next patient. Back in Romford, at Queen's Hospital Maternity Unit, 28-year-old Shirley has been in labour for well over 5 hours. Her mum, her son OJ and friend Ona are by her side.
Slower. Okay, squeeze my hand a bit now. Squeeze it. You're doing well.
She wanted a natural birth without pethidine or even gas and air, but the pain is getting to her.
I think I'm gonna go for whatever now. CS, epidural, whatever. It's too much.
So which one do you want?
Midwife Boachi has been with Shirley throughout. Her shift has come to an end.
My name is Ivani. I'm looking after you tonight.
Midwife Guri is now taking charge.
Okay, Shirley, I'll examine you.
Shirley has the potentially dangerous infection Strep B, but has been treated with intravenous antibiotics. She's been resisting the use of any painkiller.
She wasn't using the gas and air, but I've encouraged her to do, and I think that sort of kept her, seemed to keep her calm now. She's much more calm now compared to before. She consented to epidural, but I think now that she changed her mind again and just going with the gas and air. Just going to lower the back.
Midwives and doctors on the consultant-led labour ward are keeping a close eye. They're worried the labour is taking too long.
Almost done. You made a good progress. You're about 7 centimeters dilated, which is really fine. So basically, we just keep an eye on you, and then we'll come and examine you in 4 hours' time.
Shirley has had contractions for more than 12 hours.
There's one there, just use that, I'll bring another one.
She and her friends and family are all exhausted.
Hasn't slept since 3 a.m, so makes sense. I just wanted to see the baby today. And what will happen since I leave? It's gonna happen, isn't it?
Can you open your eyes? Open your eyes.
Staff are getting concerned about the baby and want Shirley to give birth soon. Midwife Guri calls on Sister Gorska for help.
Shirley, can I examine you?
Shirley, come on, help us now. We want to help you get baby out. Come on. Baby's getting tired in there.
What she needs to do, she needs to stop using gas right now. And this leg, pull this leg here. Leave your gas, don't use gas right now, okay?
Sometimes they need that second person coming in to say, come on, you have to do it. We have to get this baby out if things don't look, not looking, good, and we need urgency to get this baby out.
Yeah, and big pull. Keep pushing. Baby's coming.
Finally, just after midnight, after 12 hours on maternity bed 7, Shirley gives birth to a baby boy.
How are you? That's it.
Weighing a healthy 10 pounds, 8 ounces.
Done. Happy birthday, young man.
It's a very good experience. I think she did really well. She didn't make noise, but I still think she did really well.
Feels good.
Yeah.
I'm so tired. Exhausted. Yeah.
Our hospital beds have given us intimate access to the work of the NHS. Josephine managed to make the speech at her grandson's wedding. Daniel's recovered from the bumps and grazes to his head, and he's still enjoying chocolate. Carl can now breathe properly through his left nostril, and Shirley is enjoying life with her new baby boy, Tyler. The beds are now back on their wards, ready and waiting for their next round of patients.